Dr. Danny DeRose from the Cachet Village Animal Hospital. Thank you, Dr. Danny, for taking some time out with us.
Well, thanks for having me here today.
And we've come in because we want to ask you a couple questions. Society's really changing on their viewpoint of vaccinations. And currently I'm a co-chair of an off-leash dog park that's going to be taking place in Northern Ontario. And there was some rule signs that were going to go up saying no permittance to any pets that weren't up to date. And there's quite a debate going on that topic right now. So I'd like to get your opinion on to vaccinate or not to vaccinate.
Okay, well that's a complex question for sure. There's a lot of information out there, different sides of the fence. You know, some people are for it, some people are against it, obviously. But we have to realize is there are viruses out there that are still in the population, and you know they're prevalent. You know, for example, parvovirus. I see that quite often still in puppies.
And we keep hearing about the parvo actually from many different veterinarians. And so, what do we do if we want to skip a year? Can we skip a year of vaccinations?
Well, yeah, certainly some vaccines are currently marketed for 3-year use. There's some vaccines made by some companies, like the rabies vaccine. Most of the ones I use now are 3-year vaccines, as well as the distemper parvo combo vaccine is licensed for 3 years in most instances. So definitely, it's not so much the vaccination every year, but the examination is probably of more importance than a vaccine every year. You can probably go every 3 years with most vaccines.
And to my understanding, you can share with our viewers here, is let's say a pet's been vaccinated with parvo, can they still get parvo?
Well, it depends how many, if they've received all their boosters, you know, and they've received their birthday booster after their initial series of vaccines. The chances are quite low after puppyhood and they've received their full vaccinations. So definitely it's much lower in a fully vaccinated dog.
2 dogs in the off-leash dog park. One is actually sick with parvo. Owners don't know it yet. The other dog comes into the park, is totally up to date with its shots, boosters, etc. Can the one that's totally up to date with its shots, boosters, still get contaminated by that infected dog with parvo?
Well, yeah, I mean, no vaccine is 100%, just like no medication's 100%. So sure, there is the small possibility that they could always come into a situation where they could become infected, albeit quite low the possibility, but you know, much lower than if your dog is vaccinated than unvaccinated. But for sure, there's still a small chance, very low, just because nothing is 100% in life, no vaccination.
Now I understand there's a testing that our viewers, there is a suggestion that people who are adamant against receiving vaccinations, that there's a test called titer testing. Can you share a little bit about that with me?
Yeah, so titer testing is definitely something that is starting to become more popular and prevalent, especially with owners that are really concerned about putting excess chemicals and vaccines into their animals. It is something definitely worthwhile considering. It's quite a bit more expensive than traditional vaccines, but it can give us some really good information about whether your animal needs to be further vaccinated or not. There's something to consider though with titer testing, is there's certain viruses that the titer testing isn't 100% for yet. Like for instance the lepto vaccine and bordetella. The information we get from that is not as reliable as it is for some other vaccines like the distemper and the rabies. And also in dogs that have had titer testings that have been previously vaccinated, if the titer is showing high levels, that's a good sign, but if it's showing low levels, it doesn't necessarily mean that they're unprotected as well, because the body has something called cell-mediated immunity, which can give the animal still protection even though it's not showing up in their bloodstream. Their cells could still have protection against those viruses, and you're not really going to know that by the testing that you're doing. So it's difficult to say whether or not an animal is 100% protected. The test could show that they're low, but still have adequate protection. That said, most townships still require, you know, the rabies vaccine at least every 3 years, and very few townships will require accept a rabies titer as proof of vaccination.
So, Dr. Danny, at what age would you refrain from giving vaccinations to your pet?
Well, I don't know if there's a particular age they can set in stone as being the mark to stop vaccinations. Certainly once the animal gets into their senior years, generally considered, age 7 to 8 and upwards, you can certainly, reduce the frequency of vaccinations, likely because the antibody levels in those animals are likely sufficient enough at that point that they don't require further vaccines.
And then with the antibodies, we test that out via the titer testing?
Yeah, you can do the titer testing, but like I said, keep in mind that even if an animal's been vaccinated and the titers are low, that also doesn't mean that they don't have adequate protection, because there's certain cells in the body that can still contain antibodies that you won't pick up in the bloodstream. So I think we have to, it goes by case. If your animal is in a situation where they're around a lot of different animals, or they're up north and they're susceptible to things like leptospirosis, then I would maybe consider continuing with the vaccines. Maybe at least you can pick and choose which ones maybe you think are more important, like the lepto maybe if you're going up north a lot. But at the same instance, I think we got to continue to focus on the annual examinations once the animals get older, even if the owner doesn't want to do vaccines, or they don't feel their animals at risk for developing these viruses. That annual vaccine and blood work is probably key, especially as they get older, for sure.
Now, if my pet received the vaccination, what would the signs of allergic reaction be?
Typically, signs we see develop within an hour to a few hours afterwards. Swelling of the face, one of the most typical signs. Hives along the body, difficulty breathing, vomiting is another allergic reaction we can see. Less severe, but certainly for animals, difficulty breathing or swelling of the face, you want to bring them to your vet right away and give them some injections that can help them get through that reaction.
Thank you, Dr. Dan.
Oh, my pleasure.
Now, Dr. Danny, tell me, have you seen a change in society over the last few years with regards to concerns to vaccinate or not to vaccinate?
Oh, definitely, yeah. I think there's more information out there. People are tending to do their own research, which can be good and bad depending on where they're getting the information from. But certainly there's a movement towards, putting less, chemicals, vaccination, viruses into the body. People are like that with their own families and children, so they're trying to move that way with their animals as well, which in a lot of instances makes sense. There are certain times where we can get away from doing as much vaccines as we can. I think we should still stick with the initial puppy vaccines for sure, that those are the most important, I think, in terms of vaccinations. That's when puppies are the ones who are most susceptible to these viruses. Like things like parvovirus is still very common in puppies, so we got to make sure we're protecting those animals against those viruses. And I think as we start to learn more about titer testing, I think we can definitely put that to good use. But we have to keep in mind what the results mean, and we have to realize that there are some limitations with the information that we are getting from those titer tests, and use that information accordingly to decide how to best protect our animals and our families as well. Because there's certain viruses like the leptospirosis that can be transmitted to people from your animals, so we got to, assess our risks and look at how the titers, vaccinations, and put this all together to kind of formulate the best course of action to protect our animals.
So it sounds to me that there's actually no clear-cut answer for our viewers. Do we vaccinate or don't we vaccinate? Is it?
Well, I would say that for puppies, I would definitely do the full series of vaccinations. Up until about the age of 4 or 5, definitely I would continue with the vaccinations. We have the 3-year rabies vaccine, so we can do it every 3 years, as well as the 3-year distemper parvo vaccine.
Again, I guess it depends on the environment and like you said, the risk factor.
Yeah, for sure.
So I guess there is, again, going to no steadfast rule with regards to rules that are going to be implemented outside of off-leash dog parks. Should we have signage saying that no pets should be entering that aren't up to date with their shots, or shouldn't we put that rule? What's sort of your personal opinion on it? I know it's a difficult question, but...
Well, yeah, I mean, the thing with vaccines is nobody wants to put their animals at risk, right? So you don't know when a dog comes into a park, you don't know what that animal's exposure has been. You don't know what other animals they've been exposed to. You don't know what other parts of the country they've been to. Maybe they've been out of the country. Maybe they've been to places where vaccinations aren't very prevalent, and the diseases that we vaccinate for are certainly more prevalent. So that dog could have been exposed. They're coming back up here now to a dog park, and you basically don't know what protection they've had or what they've been exposed to. So I still think in those instances that if people are deciding they want to go to an off-leash park, I think it should be the responsible thing to do to have your pet vaccinated for sure, to protect them. My personal opinion, I think if you're going to parks like that, to be mindful of other people, you know, just that you know, you may have an opinion where you don't want to vaccinate your animal, but other people do want to have that protection, especially for their pets, and I don't think it's fair to expose their pets to things that maybe your pet's been exposed to unbeknownst to you, but you know, at the same time still could potentially affect the animals, you know.
Well, thank you very much, Dr. Danny. And again, here we are at the Cachet Village Animal Hospital with Dr. Danny DeRose. Dr. Danny, share with our viewers, if they need further information, they can visit your website, and your website address is?
www.cachetvillageanimalhospital.com. We're also on Facebook and Twitter right now, so you can follow us on there. We're always giving updates and good information out there.
Very good. Thank you very much, and we'll look forward to our next segment of Pause for the News.
Great, thanks.
Thank you, Dr. Danny.